Hi, my name is SHAN with matrix number of A18GH0126. My supervisor is Dr. ROBIAH binti SURATMAN. Today, I'm here to present my undergraduate project 1 with the topic of impact of COVID-19 toward the survival hotel. This slide shows the outline of today. The global COVID-19 pandemic has had a devastating impact on the entire hospitality industry. Hotels have been overwhelmed by the increase in room booking cancellation, and the economic growth has surely shown a drastic fall due to less demand because of this issue. Hotel industry professionals are under immense pressure, dealing with partial or complete closing, financial losses with largely unchanged fixed costs, and uncertain short-term and long-term demand for the hotel rooms. On the other hand, the COVID-19 pandemic also had a bad impact not only for the industry, but for the hotel employees. Based on the World Travel and Tourism Council, quite 1 million jobs are experiencing risk during the pandemic. It is predicted that around 75 million jobs are risky enough. The hotel industry is part of the highest risk industry that is experiencing job loss. Things will not be the same as before since the demand didn't exist like in the old days. This situation had forced the top management to think about the plans or strategies for the hotels to keep on surviving as the hospitality industry was experiencing approximately 5.5 trillion losses in the year due to the MCO. The COVID-19 also results in the hotel staff facing job loss as the hotels are not capable of paying their salary as they should. To cut the cost, some of the top management of the hotels have agreed to lay off the staff or ask them to withdraw themselves voluntarily. Investigation has been made by the researchers which came out that 1 per 10 to 1 per 6 of the staff of the hotels voluntarily left the job. The hotel industry depends on the demands or the needs and the wants of the people. It is crystal clear that the hotel business cannot be run when there is no demand from the people. So, in this study, the main focus is to identify impacts and the hotel strategies to survive during the pandemic. The main problem of this study is the low hotel occupancy rate during the pandemic. The demand seems impossible when the guests are still afraid to travel due to this pandemic. A lot of people were afraid to travel and spend the night at the hotel due to COVID-19. This has affected the tourism industry, especially the hotel industry, as the number of guests to check in at the hotel had dropped in numbers. As COVID-19 continued to impact tourism and hospitality, evidence shows a job loss in some of the large chain hotels, for example, Marriott and Hilton. Some researchers highlighted that tourist attraction and the accommodation sectors proclaimed the greatest slump in their staff figures. Some hotels are also considering temporarily closing the business, especially chain hotels. In China, 150 Hilton hotels were closed because of the pandemic. In Malaysia, Jazz Hotel, Mercure Penang Beach, and Gurney Resort hotels and residents decided to temporarily close their business due to the COVID-19. There are 3 aims of study. First is to understand the impact of COVID-19 pandemic on the survival hotel in Johor Bahru. Second is to identify the strategies applied by the management of the survival hotel in Johor Bahru based on the data collection from the interview. Third is to provide reference for similar research for the other students or other researchers. So, in this research, we have 2 objectives to achieve. First is to identify the impact of COVID-19 pandemic on the survival hotel in Johor Bahru. Second is to identify the strategies applied by the management of the survival hotel in Johor Bahru. The scope of the study is to focus on 4 to 5 stars hotels in Johor Bahru, and the second is to understand the strategies applied by the management of the hotel during the COVID-19 pandemic. There are 2 significance found in this study. First is to provide reference for similar research, and the second is as a reference for the hotels in case of similar outbreaks in the future. There are two expected findings in this study. First is to achieve the objective by obtaining accurate data from the interviewee. Second is to pick up a reference in case of the similar situation happen in the future. Now comes to the literature review part. In this literature review, we will discuss about first the definition, second the impact faced by the hotels, and third the strategies. Here shows the definition of the survival hotel and the COVID-19 pandemic. The survival hotels are usually related to the naive adaptability, which is a business ability to easily and quickly adapt to safer health practice in the pandemic. Due to COVID-19 pandemic, according to a new statement issued on March 6, 2020 by the United Nations World Tourism Organization, the pandemic will lead international visitor arrivals to decrease to 1 to 3% relative to 2019, rather than the predicted growth of 3 to 4%. In a news release issued 3 weeks later, on March 26, the government revised its estimate to a 20 to 30% reduction in international arrivals. As an increase in COVID-19 cases began to occur in early March, the Young Diputuan Agong expressed great concern about the escalation of the outbreak and measures to combat the outbreaks via live nationwide telecast on March 13, 2020. The Prime Minister of Malaysia later announced a National Movement Control Order, MCO, intended to mitigate the spread of COVID-19 through social distancing on March 16, 2020. From that point forward, all enterprises, including hotels, airlines, and tourism, had been halted, and Malaysia's Prime Minister declared that foreign visitors were forbidden from entering the country and that travel was not permitted. This piece of news had a huge influence on the hospitality industry. As we all know, tourism has risen to become Malaysia's third largest source of foreign exchange earning, accounting for 7% of the country's total GDP in 2005. As of 2011, Malaysia was rated 9th of the list of the most visited countries in the world, trailing only Germany. Thus, as a result of the negative impact of numerous Kuala Lumpur hotels on the local hospitality industry, several of these establishments are facing partial closure as their occupancy rates have fallen to an all-time low. Several 4- and 5-star hotels in Kuala Lumpur have reported that their occupancy rates are currently below 10% and that their operations are temporarily suspended. However, in order to remain viable, it is necessary to do so temporarily until the situation improves. This table shows the hotel room cancellation and losses due to travel fear and restriction from January to March 2020. Because of the increasing number of infected cases, the country was placed under a Movement Control Order, MCO, that was in effect until April 14, 2020. With the exception of essential service, many other aspects of the company's operations have been significantly slowed or completely halted. There are many other economic sectors that are connected to the tourism industry. These include hotels, community activities, education, finance, travel and transportation, construction, retail, and so on. In the country, there are 4,880 hotels, including budget accommodations, that are registered with the Ministry of Tourism, Arts and Culture. According to the Malaysia Association of Hotel, there are a total of 75.69 million ringgit in losses were recorded by the local hotel industry from January 22 to March 20, with a total of 193,057 room cancellations recorded during the period as a result of the pandemic. There are 3 strategies discussed in this literature review. First is to lowering the cost, second is to becoming a quarantine hotel, and the third is applying a pricing strategies. According to the Malaysian Association of Hotel, from a sample size of 17,826, a percentage of 20% of the hotel staff had been asked to take unpaid leave, and 60% of the hotel staff had experienced a pay cut. Some hotels preferred to cut the labor cost or apply the pay cut towards the surviving hotel staff. Hotels in Kuala Lumpur had recorded about 5,054 employees getting deduction pay. This helps the hotel to be able to survive a bit longer in the industry. In addition, the hotel can take an alternative to reduce electricity in daily operations during pandemics. The utilities have the second highest operating cost after employee wages. Saving in more effective energy use can lead to major reduction in operating costs and energy bills. Hence, during these pandemics, most of the sessions in the hotel cannot be operated and must be closed. This will make the usage of electricity reduced and also the cost for other utilities. This reduction will help the hotel industry to reduce costs and survive during this pandemic. Instead of temporarily closing the business, being a quarantine hotel is a good option. The hotels were determined to be a quarantine center with a monthly rental in order to catch up and make a profit even at a small range. A quarantine center existed to accommodate people who are subjected to quarantine orders. Usually, a person that had direct contact with a positive COVID-19 person will need to undergo quarantine for 14 days as per WHO and the Center of Disease and Prevention suggestion. Before the hotel continues to operate as a quarantine center, the hotel staff needs to undergo a good exposure on how to handle the guest or the person under its surveillance once the hotel starts to operate as a quarantine center. It is also a need for hotel staff to know the way to avoid being exposed to the COVID-19 danger. Training is a proper term. The training helps to educate the hotel staff on the importance of avoiding the COVID-19 infection. For example, the training can include how the virus can be infectious, the infection symptoms, ways to self-sanitize and disinfect things, and more. The hotel staff also had been educated by not wandering in the public areas and reducing direct contact with the guests as it is a big chance to cut the risk of COVID-19 infection. Hotel as a quarantine center helps in terms of generating profit at least at a minimum range. It has brought necessary revenue for the hotels during COVID-19. The hotels can take the initiative to decrease the room rate to attract the guests to check in. It was because the room rate revenue was low during the COVID-19 pandemic. This is the true fact of the hotel industry where the supply is fixed and the demand is varied. Since the demand for the room declined, the management needs to decrease the room rate to increase the demand. This will help to cover up half or quarter of the expenses. According to the research found, it was a great chance for the guests to pay a visit and experience the hotel service at a much lower prices. In addition, hotels can implement a solution to stay in the hotel even in this pandemic outbreak by offering various packages which suit the needs and wants of the guests in this current situation. For example, the work from home hotel package and renting out their meeting room as office space. The hotels in Klang Valley and Penang had tried to market their hotel room with work from hotel package with a lower room rate. Gurney Drive, as a 5-star hotel in Penang, also introduced a co-working space in the hotel for individuals to work. In this study, primary data were gathered through interview with hoteliers involved in the management of the survival hotel in Johor Bahru to gain their perspectives on the situation. In order to fulfill the aim and objective of the study, the researcher will create an interview questions that are relevant to the study's goals and objectives. Secondary data is data that has been printed and processed, such as journal, working paper, books, and any printed material related to this study. For the analysis data, the qualitative technique was chosen by the researcher since the primary data collection would be conducted through interview with the respondents who will identify the person involved in the execution of this concept. As mentioned just now, the COVID-19 outbreak has given a big impact on the hotel industry whereby hotels have lost revenue and leads to the worriness of the survival of the hotel. From the past, research shows that the three strategies mentioned above are effective in helping hotels to survive through the pandemic. The top management of the hotel should always be well prepared regarding any knowledge of crisis management to cope the similar unwanted situation in the future. These are the reference. That's all from me. Thank you and have a nice day.